There you go. It's my account, so I can control the recording. When we have it through ACPE, we can't record unless they make us the host. And they won't do that until you've signed on. So you have to get them the minute you sign on. And I have found that problematic.
Mm-hmm.
So since we were using a different date, I said, well, I'm just going to use my own account and then I can record it and we'll see how it goes.
That's good. It's too bad we don't have a recording of some of the other sessions we've had.
I know. I know. For the last three, the several presenters that we've had have all been great. Molly's and Lauren's, and we've had a couple before that. I would have really liked to have recorded those. I'm going to shut my window. I have a truck outside. I think they're picking up yard waste. So Daniel, I don't think we had an agenda beyond just catching up with each other, talking about the ACPE conference, how that impacted folks, and if there is something as a community of practice that we can address the issues of racism and bias and white supremacy in our work here. Just hearing people's thoughts. I know there was one presentation on trauma, racism, and the arts, and I was only there for half of it, but we didn't even get to the arts by the time I left. So I'm wondering if anybody stayed for the whole thing. I would love to hear what came of that. So where would people like to start? I'm not hearing anything.
I was signed up for that workshop too, and I couldn't get to it for various reasons. And so I was a little curious to see if what they were doing with the whole arts part of it in the second half you had to leave for. So I don't know if anybody else was in that workshop or not. Doesn't look like.
No.
And they didn't record it.
Hmm.
So it's one we don't have. Does everybody know each other's? Do we need to go around and introduce ourselves?
I think that's a good idea.
All right. How about you start, Daniel? Or do you have food in your mouth now?
I do, but that's fine. I'm eating peanut butter.
Oh.
Which is my regular lunch since I was a grade school boy, and that's still what I make when I'm eating at my desk. I'm Daniel Silverbush. I'm the co-convener of the Arts CoP with Marianne, and I'm based in Brooklyn, New York, and an educator here. I supervise a residency program.
And then I'm just going to go around my screen, so I'll go next. I'm Marianne Brody, and I'm a certified educator in Rochester, New York, in a community and congregation-based program called Crossroads of Caring.
I'm Steve Dutton. I'm an educator at Christiana Care Health System in Delaware. And that's me. My first time to be here. Great to see everybody.
Welcome.
I'm Yvonne Valeris. I'm in Cincinnati, Ohio, and I'm a certified educator.
Cincinnati, Ohio. Are you in a hospital, Yvonne?
Christ Hospital.
Christ. Mary, how about you?
I'm Mary Brown. I am a certified educator. I manage a department of spiritual care at Yale New Haven Hospital, and we just became a system center because we have 2 hospitals, campuses that are geographically separated, even though we're one. And so I'm also then the system director of the CPE program, and I do a residency over here, and that's me.
Lauren, how about you?
Hi, I'm Lauren Frazier McGuinn. I'm an educator here at Baylor in Dallas.
And Mark?
Hi, I'm Mark Eberly. I'm at the VA in Pittsburgh. I also was in on the trauma, racism, and arts, but I had to step out. And they started to talk a little bit about arts, but when I stepped back in, it seemed like it was not real strong as far as what they were tying it into there. They did tie it in, but not real strong. But I missed that part when they were tying it in.
Yes. Susan?
I'm Susan Iliff. I am in the Reading, Pennsylvania area. I'm a CEC, previously affiliated with the School of Health Sciences at Reading, currently serving as a chaplain at Reading Hospital.
Thanks. And Molly, I think you're the last one.
Sorry about that. I just am still the Bellevue CPE supervisor, and now I'm the director of the program. And so I have people coming in and out, and I'm trying to manage being here and there at the same time. So I'm sorry that I'll be in and out, but I'm thrilled to be here. And I'm in New York City at Bellevue. You're right.
Cool. So I'm curious, of people's experience of the conference? Did you all attend at some portion of it? Yes. James? Do you see any connections between the work that we did there and work that we might do as a community of practice?
I have to admit, oh, I'm sorry, go ahead.
Go ahead, Molly.
I was just gonna say that I found that the participating in the conference very complicated and difficult for me. And I will definitely, I have a queue of the presentations I still want to watch, but I look forward to like being with everybody and setting aside the time. You know, over the last 3 weeks, it's been a lot of like a little bit here and a little bit there, and I couldn't keep track of my schedule. So that was very, very challenging. I think what really stood out to me, though, that we could probably incorporate more and more is adding voices to our community practice and expanding our resources of where we pull from in terms of poetry and, you know, the canon, the American canon of poetry is very white. And we owe it to ourselves and our students to just like expand that to include more Native American voices, more African American voices. That was really my takeaway.
That's pretty much the same thing I was going to say. I felt like there was definitely room for moving out into other non-white, non-typical, whatever. To me, probably the most impactful or helpful is a better word because everything was impactful, but the most helpful workshop that was related to what we do was, I think, the one that Imani Jones did about her theory papers. There's just something about all those different voices that she brought in, the way that she did it, and there were just things that I left that, and I leave the conference thinking like all my critique of all my theory papers was just critiquing like white people from white people. And that seems to me like an impoverished way of understanding what we're doing. And so I was really excited to like grab hold of some of those authors that she mentioned and some of the theories that she mentioned, and really just learn more and explore more about how to critique my own theories. you know, with somebody besides the feminists instead of white men.
Yeah, Mary,
And also that it seems to, like, I use a lot of film as in other things, but film in particular. And I, for many years, have not relied on just like straight up white people film to like try to really look at something like grief and loss, or family systems, or different emotions like anger, or so forth and so on. And there's so much out there in that way. Even the TED Talks and YouTube videos and stuff, helpful.
I think film is a good way to bring in different narratives and expand upon what students and we are experiencing in the clinical setting, and a fuller set of people's stories. That was one of the things that Lauren brought out in her presentation.
Yeah, and we were talking about diversifying how in some places it may be taken intention, but it's possible to diversify your professional advisory committees, presenters, and that's all part of bringing in those diverse voices. And I was thinking about, I don't know if it was you, Mary, or Molly, who talked about, or maybe you didn't, non-white. I was thinking about non-white modalities. I thought about the quilting that was at one of the arts workshops in New York
That's
City.
Daniel.
Yeah, and or bringing in like I have a dream catcher on my wall, like things that are not typically considered white kinds of modalities and how they might be useful in reaching different, thinking about things in different ways.
One of the last presentations that I heard, I guess it was on Thursday, was with Phyllis Shepard, who I think is a psychotherapist. And it wasn't about the arts, it was a womanist perspective on education. I found it to be extremely powerful. Part of what she did, which I liked, was the arts where she had integrated images that she created into her PowerPoint presentation. So there were multiple modalities for how she was communicating about things that came up with students and her own process of processing her emotions and expressing them and bringing them to the fore. And it was in the service of making space for students for whom the way that we've always done things. She was talking a lot about decolonizing the way that we've done things, making space for students who don't necessarily communicate or know how to communicate or feel at ease writing papers or presenting papers in an academic way. And she modeled that. So I found that to be powerful. And I thought it connected very much with the work of our COP in terms of opening up nonverbal other ways of communicating that can speak both to different students and also to different patient situations. So it struck a chord with me.
Yeah, that's been true for me for a long time, that thinking about CPE, it's very writing based. If you're not a good writer,
Yep.
you're not going to get certified as an educator for sure. And you're not going to get, you're going to have difficulty making progress unless there are different ways of assessing instead of just having a written self-evaluation. There have to be different ways to express yourself.
Yes.
Huh. Who was the presenter for that, Daniel?
Her name is Phyllis Shepard, Dr. Phyllis Shepard. I forget where she was based.
Do you know if that one was recorded?
It was a workshop, so I'm not sure. I don't know that they recorded all the workshops. but she also presented in terms of vignettes. So that also spoke to me because each one was archetypal. From like the patient who came to her for the first time with the Bible and said like, this is how I want to begin my therapy. And she was like, at first I was like, no, you can't do that. That's not how we do psychotherapy. And then, you know, as she matured, she was like, well, that was this man's starting place and where he felt safe. And why wasn't that all right? So that was one bit. I could reel off more of it. They stayed with me. Anybody else?
That kind of reminded me of one of the early speakers who talked about demolishing the images and the need to really demolish them. And that seemed to me, that's as much artistic as anything. Demolish and then recreate new images.
That brings me back to when you presented, Mark, and the song that you brought in.
Mhm.
And I have another song that I use. That's actually very powerful, and it is much along the same with the same topic. And I say song because a lot of students do not think of it as music.
What's the song?
It's called "Come Out" by Steve Reich, in a musical genre called music concrete. And it's a recording from the 1966 Harlem riots of a African-American young man who talked about after having been beaten by the police, he had these bruises that he had to squeeze to let the blood come out to show them in order to be taken to the hospital for treatment.
Wow.
And it uses his words, then that's the only thing it uses the entire time.
Thank you. I'll check that out.
It's a little longer, so about, I think 10, 12 minutes long. I've been amazed at the emotional response that it evokes from students, a wide spectrum.
I'm still trying to finish attending the conference because, like Molly, I struggled with the schedule in the midst of working, and then to try to watch a webinar at home with kids is just crazy. And then also the times that I could attend, some of the dialogue was difficult and painful. I have to say, after the past year, I really didn't feel like saying more. And I don't know what else can be said sometimes. And it feels like an injury to have to explain my perspective over and over again. So some of the sessions were hard for me to attend. Once I had the time, it was really difficult to sit in. But I think the helpful ideas about decolonizing our process and what we read, how we structure our curriculum is always important. And I think the arts provide a lot of avenue for connection outside of kind of our canon or our privilege canon. I think that being willing to be flexible and, you know, to meet our students where they are, while we're always telling them to meet the patients where they are, I think is a mark of a good educator. So, I really am hopeful for what we can do in our COP, as far as challenging and deconstructing some things.
The language of habits and practices spoke to me in that way, re-examining our habits and our practices. And that was part of what Phyllis Shepherd modeled and how she was reviewing herself and provoking me and the rest of the people to review. And why we don't have to do things the same way we've always done them or that we were taught to do them. So I see that very much as the work of the COP.
So say more about that, Daniel. You see that language of habits and practices, reviewing them. And Lauren, you talked about the decolonizing. What would that look like? Beginning.
I don't know if other people want to respond first. I need to. I think part of what stood out to me is, you know, I've taught things in a particular way, or I teach the students to write verbatims in a particular way, but it doesn't have to be done in this way. And if somebody wants to do it in a different way, why not? And trying to be open to what they might want to bring in and how they might want to bring it in. You know, and she was funny about that. She's like, look, you want to throw out how I want to do it? That's fine. This is Phyllis Shepherd. But, you know, I'm also part of an institution that I'm accountable to. And the institution has certain expectations. So I kind of like that in terms of thinking about it. And I've had students that said, do I need to do all the parts of the verbatim or this and that? And I think just being willing to say, maybe you don't, but how do you want to do it?
Yeah, I think we can get stuck in our kind of old ways of engaging the outcomes. You know, we had an interview last week with a student where I was wondering, you know, were we having trouble communicating because of a language barrier, or was it that we were not, you know, we were asking her questions like, what is this educator inviting you to do? And for a non-English speaker, are they really hearing an invitation, or are they hearing kind of our CPE way of saying, oh, we're inviting you, you know, we get comfortable even in our ways of connecting that, you know, it doesn't work for everyone. So just rethinking even the ways that we assess people, even in the very beginning. And that might mean reading applications that you normally would toss out, or asking for a rewrite, or offering, you know, like you said, for people who struggle with writing, how can we still engage those students who may be very talented caregivers, but they just struggle with this particular mode of learning. I've changed the way we do verbatim if I feel like a student is struggling with a particular learning issue. I'll say, okay, just give me the dialogue, or rewrite this verbatim in the way that focuses on what you did well, or, you know, rewrite it the way you wish it had gone, just to try to do different things to get, you know, at the learning need or the strength, instead of kind of trying to force students to learn in this modality that we are accustomed to. And then also offering support. I mean, our outcomes or our new accreditation requirements require that we have some type of learning support. I'm a former English instructor, so thinking about the ways that certain students are barred access to CPE because of deficits in their previous learning. What kind of support do we really provide to people who struggle with writing or struggle with charting and computers and things like that? We expect them to really come here ready to do the work. How much are we willing to support them in the midst of everything that we're doing?
Thank you for sharing that, Lauren. In the verbatim, what I do sometimes, I do spontaneous verbatims in the form of role plays. Can you hear me at all?
Can you be a little louder? I
Yes.
want to hear more.
Can you hear me now?
Better.
Thank you. Yes, I do spontaneous verbatims in the form of role plays because I really don't have a simulation setting. And I have one student divides the group up into roles. So maybe two students might ask questions at the end of the role play of the chaplain. One or two might give strengths for the pastoral work, recommendations, and theological, and another one will do theological reflection. Within that, they must demonstrate the spiritual assessment tool. Spiritual assessment tool, and how would you document this note? So my model actually came from board certification essays, that framework, all the parts they want in that clinical contact. So then I just took that and make it funny. So when they come on, they don't know who's going to be the patient, who's going to be the chaplain, what the case. In other words, they don't know what the scenario is going to be, but ahead of time, they know who will be chaplain and patient.
It sounds like part of what you're teaching is improvisation.
Yes, like that. Yes, like that. And I think the nice thing is we're talking about racism and culture, and it fits into the 7 C's of cultural and emotional intelligence under collaboration. So, or how to learn to be a team player. So that's another one of my theory, that they learn how to interrelate, whether they are white, Black, Hispanic, whatever religion. There's interaction from the whole group as a whole.
They're learning collaboration with each other and with you.
Absolutely.
I did something similar to that with a group where we had like a scenario of a patient. Here's the scene. And then they had to write the dialogue, like what the patient said, what the chaplain said, what the patient said, what the chaplain said. And we did it maybe for about, say we wrote these things for 45 minutes or so. So then we had like the beginning of a visit, and then they had to take that and finish the visit and then do a reflection on what they wrote. And they came up with some really interesting like ways of which way this visit was going to go and the interventions that they explored. All different, even though they had the beginning of the exact same visit.
And that they did through writing?
They did it through writing, and they also can use pictures. I let them use pictures a lot to like, I don't know, depict like an image that came up for you in this visit or when you're writing this, or a theological image that is related. Just draw something. It could be anything. And we do like a live sort of verbatim too, where they bring their they bring just the dialogue with no reflection, and then we do the whole reflection together and use pictures and just like words and phrases, and rather than it being like a big fancy write-up, it's just all it sort of appears more in images and words.
I have a couple of things that I'm meditating on that I'll throw out there to the group, that I'll present as challenges. One is the silent group member in a modality where we favor the verbal, but how that person could be invited to share, not necessarily verbally. I'm thinking about that, particularly having had a resident who was very quiet throughout. And then, I make space and invite the person to share, but maybe that's not the thing. That's one piece. Another thing that I've been thinking about is students that struggle with exactly what's part of what we're talking about, in the moment exploration, that do need more of an asynchronous or need time to figure things out on their own, and how that can be honored in a group process and a unit process, rather than it being made something that's bad. Because I certainly prize in the moment abilities too.
Those sound like tricky learning issues in some way. And when I think about the parallel with patient care, I wonder a little bit about that too. Like the ability to think on your feet sort of thing is always tricky when people are on call and there's not like a structure for every single thing that's going to happen.
Yes. I think one of the themes in the conference that was important for me, because it's so present in my setting, both with my students and because we're a trauma center, was the theme of trauma and re-traumatization. And I heard it what you were saying before, Lauren, of it was hard to have to explain again my experience and my feelings. That's a theme with my students. And because we're dealing with recently a lot of gunshot victims and other types of violence that comes into the hospital, that also touches into some people's personal stories, some more than others, depending on their race and economic background. But how do we work with trauma? And how do I work with a traumatized student who, in the moment, emotionality is not easy for good reasons? But they may be more at ease in the patient arena than in the group arena. That's because the group arena is about their feelings. When they're focused outward on other people, that's an easier thing. Just, I'm picking up on what you're raising there.
Yep, I agree with that. This past year I almost had like a Jekyll and Hyde group. They were like star performers out on the floors, but when they got together in the group, because there were a couple of them who had some pretty significant childhood trauma issues, they found it very hard to connect all the time verbally, which is why I stopped making that such a big deal. Like letting them draw things and use other language like poetry and just words themselves seem to be really helpful for them.
I love the literary description. I'm going to steal that for the clinical versus the learning environment.
And feel free to use Jekyll and Hyde too.
That's what I meant.
Right. Yeah.
That is a frame.
Yeah, that's never happened before. Usually the ones who are traumatized in general seem to struggle a little bit too with the out there, but there was not so much of a struggle in the clinical arena. Just, I think, revealing themselves and letting people, the vulnerability factor is just like very threatening to a couple of them.
Yeah.
And I think also I had to incorporate more like playful things to just try to lighten them up a little bit so that everything wasn't so like anxiety provoking. And I had to let one of them knit or else she'd fall apart. Just to like corral.
Well, that as an activity in a group in and of itself is a fascinating thing, because it's literally weaving something together with one's hands.
Yes, but then some other people found it to be like a interfering behavior because, you know, she's not like always maintaining eye contact. She's looking down at what she's knitting and she's always moving and it's a little distracting, etc. But it helped her stay present in the group. So
I keep a basket actually of manipulation things, a fidget spinner, squeeze thing. I've had a lot of students who need to be doing something with their hands, but trying to provide them something that they don't have to look at to fidget with their hands. And some of my students have added things. Some of them get anxious during individual or during group. And so it's just you know, I have kids who are ADD, so I'm used to the idea of having manipulatives, but I found it's helpful to have some available.
As you're saying that, I'm playing with my cards, as I often do in these types of things.
And I found this on the internet when you talk about games, a mindfulness games card game. And it's actually, the way that it's described and used as it comes is a competitive thing. I don't know how you do mindfulness competitively, but there's some real fun activities in it that are silly, but also have some mindfulness. I should grab it and see if I could, let me grab it and show it. If I can find it.
Yeah, I think some of this may have to do with learning style too. I'm a kinesthetic learner. So I've got, you know, I learn better when I'm got something in my hands or doing something with them.
But this is a stand up and move around game. You know, there are different games in different ways. I've kind of created my own way to use the cards besides the competitive thing that it does. But I find that the groups are helped by having a lot of different modalities of learning. And this is a real active one.
Thanks for the resource.
You know, as we talk about working with students, I'm wondering if others encourage their students, or I don't want to say require, but require students to use arts in any way in their practice. So I'm just thinking about all the different patients, clients, residents that students come in contact with who may have some of the same drawbacks that they do about engaging verbally. especially I'm thinking about my community settings where sometimes the interactions are hit or miss. It's not like they're stuck in a room where where someone can trap them. It's there's meeting them in common rooms, or they're seeing them at the lunch table, or they're seeing them on the way in or out from job program. How can they use the arts as an entryway into conversation? I'm just wondering if people encourage, I'm sure we encourage it, but do we ever require it? Does anybody do that?
I don't require, and right now we don't have this available, but we have a ceramics, and it's a very powerful place to go visit with some of our veterans who are doing things, and then they'll start to talk and share some, because they have something to focus on. And I'll encourage the students to go hang out, go talk, just build rapport. And then like, you wouldn't believe what they, yeah, it's holy ground.
I do have a required art thing. There's like for their weekly reflections, instead of writing, I'm asked them to at least like 3 times during the course of a unit to try. I have 3 things. One's a mandala, one is a scribble drawing, and the other is a something else, but there's instructions on what they're supposed to do. And then they can either, if they want to write a little reflection about the process, they can. Otherwise, they just have to bring whatever they drew in and talk about it in supervision. It's very interesting what happens, especially with the little scribble thing.
I love scribble drawings.
Yeah.
Talk about Jung, the unconscious.
So we actually had a little bit of a thing with art and in patient care in the clinical setting. So we do, 2 or 3 activities during the unit that's just the group, and hopefully helping them transition from like what we do in the group and bringing it to the patients. We do the mandalas, we do collage, we did this activity with the encouragement of my peer group where we listened to each other's favorite songs and the why, and it was really very exciting in the peer group. But I couldn't get the cell phones away from them with the patients. Like all of a sudden they wanted to play songs with the patients, which was okay, sort of, except that I started to feel like the students were creating like a barrier between them and the music became, rather than like a healing or a connecting modality, but a way of like even creating more distance or working on assumptions. Like if they visit somebody with dreadlocks and they, offer Bob Marley, or if they visit somebody, who looks one way, they'll offer something different. And that's been a challenge to get that to back down a little bit. Like I'd rather than like, except for the fact that we communicate with their phones, for them to leave them in their pockets and never take them out and play another song again.
I'm missing the last part of what you're saying.
I don't like the playing the music with the patients. At the bedside. Sometimes, but even, one of the things that I think, I'm not exactly sure who said, but everybody was sort of saying like wanting the group to loosen up, right? To like play a little more. So, I had a shadow with me. We went and we visited this man whose English language was not proficient at all, but it said on the board that he was Italian and he liked Italian music. Now, I don't know any Italian music, but I started humming, hey, mambo, mambo, Italiano. And all of a sudden, the man is like this with me. Right, so there was like this playfulness, but it didn't come from the phone. So that's what I'm trying to like, art as a way of connecting, not as a way of, standing in the place of. Like I don't want art to be the transitional object in the visit. I want it to be the way that people get more connected to each other. But it's a lot to like sing in a room with your mask and I don't know any of the words, and I'm, takes a lot of confidence from the students who are often, as you say, reserved to their anxiety.
You know, along that lines, Molly, I had a student who was having real trouble connecting with this particular veteran. And so I went up to shadow her, and then we had the idea of getting the rec therapist who played music. So that person came in, and when they played this song, then my student could debrief what that song meant to him. And it really, that opened the door big time with that patient for the student.
Yeah, I'm a huge fan of co-treating with the art therapists.
What we also do mandalas in the residency. So the very first week during orientation, sort of towards the end, I give them like a wedge in the mandala so they can like express who they are and what their hopes for the program are. And then at the end, I just have a big circle and they have to work on it all together with me. So we end up with these two completely different things. One that visually looks like all compartmentalized because everybody's in a different wedge. And then another one at the end that's just everything sort of all integrated together, more like a collage.
Hmm.
Sometimes I put one in the middle 5 times, but that usually works really well. I just give them all these, like I ask them if they have magazines and stuff to bring in. They bring in magazines, and then I have all other little things that they can incorporate. And they look through those magazines, and they find the things that really speak to them that they want to put out there. And it.
How do they tell their story through a mandala?
They just get a wedge first, their own personal story. They get like a little pie wedge of it.
Huh.
And they do the same thing. There's magazines and there's colored paper and I don't know, googly eyes and feathers and pom-poms and little silly things like that. Yes. And then they just like, this is who I am and what I'm hoping for. And then at the end, it's a combination. They even printed out different pictures from the residency year to like cut out and put into the end of the year one.
So it's a mandala collage.
Well, yeah, it's really a collage, but
I see. No, I think I was.
it's a circle.
Okay.
It's in a circle, so it's not really technically whatever. They were so proud of their mandala this year too, both of them. I had one Buddhist student who made sure that everybody after graduation looked at these and compared them. Very cute.
I want to add to the mandala, taking it the circle and having students use the circle to represent their community. And ask the question, who belong in your community? Who do not belong, and what's the reason? And how would you define the persons that you know belong in your community? And where in your community, where in this circle, where in this community would the people who are dear to you be located? Yeah. Would it be in the center? Would it be far? And you position yourself in that circle and show how you are in relationship with those near to you, not too near to you, and so on. Who belong outside of this circle? People who considered maybe non-Caucasians belong outside. You know, how do you determine who belong inside? And that's like a cultural piece. And it's also an ethics? How do you interact with people who are not like you? How do you receive them and tolerate them and make them feel welcome and maintain their dignity as a human person?
You do that in the beginning
In
That's
like
an
the
o-
middle.
and in the middle. Uh-huh.
With use the same concept as a Mandela. A
So-
perfect circle.
And it's an entree to talking about social location and working with difference. Mhm.
Absolutely, and have them look within the inner person. You know, who do you consider important to you enough to belong inside this circle? You know, like people who belong to the circle, people who are important, you know, people who have value and worth. But what part of the circle do certain people belong, like your parents, your husband? Are they in the center of the circle? Because those who are closer to the center are those with most value. And those who are to the edge of the circle but inside, they're important but not that. And those who are outside the circle, well, they can be killed off because they have no worth at all. So looking at that from a cultural aspect, that's their community, whatever their community is, whether it's church, whether their whole family or what.
I like that, Yvonne. I was just trying to think of using that, if I use that and using that to challenge the students and how they may recreate those circles as part of group dynamics wherever they go.
Oh, I never thought of that, Mark. You know, because I think that makes sense, because I remember a nurse, Clarissa Roy, says that when we enter any community, the person of us who enters is not the same person who leaves. So I can see them recreating their circles.
Mm-hmm.
That makes sense to me.
It'd be interesting to do it at the beginning and at the end. Or even at the beginning of a visit, the end of a visit.
Wow.
Or
Mm-hmm.
do it with a patient. Hey, I want to get to know you. Draw me a circle. Help me draw your circle. Like, I wonder what that would be like.
That's awesome. Awesome. You know, I have an article which I haven't read yet, that they're using art or pictures with the bereaved families of the deceased hospice patients, and how meaningful, you know, that piece of art, and they can keep it with them. I said, wow, this is so innovative.
The other thing that you're talking about, the circles and having people diagram their circles, brings up for me is in my own theology of pastoral care about how we work with strangers, or who am I in other people's story? Who are they in my story? And you know, in Genesis, it's often the stranger who has a particular blessing for somebody else. So it's part of how I think about being a chaplain, that I notice is a theme that comes up with the students.
And that's so theological. The stranger is the one who comes with the blessing, right?
Mhm.
Because in the Old Testament, there's a story there with Abraham and Sarah and the strangers, and they end up with such a great blessing.
Yes.
You see, plus there's reciprocity. You just don't get a blessing, you also give and receive.
Mhm.
So I think it's so appropriate theologically.
Right. But to cultivate a curiosity about who am I in the other story and who are they in my story.
So we have about 2 more minutes. I've been taking notes, so I'll be happy to post the notes and the video of the meeting. Any other words. Barbara, what did you have there in the chat? You're on mute.
I was asking if anyone ran an online CPE program right now for folks from a distance. I know there are a few out there. I have a student who's done 2 units with me who I really am encouraging to do another unit with somebody else.
I
And
do.
an online would be, you know, possibly an option.
I do online.
You do online? I would love to learn about you're in San Francisco?
Cincinnati, Ohio.
Cincinnati, Ohio. Well, I saw the bridge.
Email me. Email me.
Okay, what is your email?
Yvonne.valeris@thechristhospital.com.
Christ Hospital.
You
Thank
can,
you.
.com.
you can also search on the ACPE website for online programs.
I have, and this student has reached out to 5 different people from that and hasn't gotten any response,
Oh, wow.
any response back. So I thought I'd try to help because it's my request of her. Thank you, Yvonne. I'll send an email.
All right, any parting words? Our next meeting is in June. And if I had to tell you the date, can't tell you the date. I'll have to go look. June
Last
28th.
Monday?
Yeah, it's June 28th.
I will be away then.
I'll be here.
FYI.
All right.
God willing.
Well, thanks for being here. Thanks for all you shared. And I'll look forward to seeing you all next month.
This
Thank
was
you so
great.
much and sorry I was
Thank you.
late.
Bye.
Have a good day.
Bye.
Bye.